Well, hey everybody, Dr. Bulow here, and welcome to another Revive video. We do on Tuesdays something we like to call Revive Testimonial Tuesdays, where we chat with patients of ours. And today we're here with Mallory. Say hi, Mallory.
Hello.
And we're trying something new. We're trying, if I hold still, trying to get it so you guys can see a little bit of our view in the background of Cranberry Township, Western PA, but it looks like the lighting can't quite figure it out. That's okay. So every Tuesday what I like to do is sit down with a patient, introduce you to one of our patients. And I think one of the things that's important for me, Mallory, is that everybody's got a different perspective. Everyone's got a different story to tell. And I think that's cool and I think that's fine. And so what I'm going to do is ask Mallory to maybe just introduce yourself and perhaps tell everyone a little bit about yourself and kind of how you found upper cervical care, or like what your condition is or what you had been through before finding an upper cervical office.
So my name is Mallory and I'm 29 years old, and I've had migraines all of my life. And so I've tried a bunch of different stuff, and I've seen regular chiropractors for most of my life. And my dad met an upper cervical chiropractor where we grew up, and I had moved out of home by that point, so I didn't really get to be a patient of his, but he introduced me to 3 other upper cervical chiropractors.
Wow, how about that? Yeah. And where were those guys located?
The first upper cervical chiropractor I met was in South Carolina.
Okay.
We lived there, and he did x-rays, and he really changed my migraine situation.
Yeah.
Really a lot. And while I was down there, I got more into the Arnold, Chiari Malformation.
Yeah.
And seeing
So that's the
neurologists.
diagnosis that you have. So headaches, and by the way, I'm noticing, and I apologize for this, like every time I look this way, it goes dark. Every time I look towards it, it lightens up. So I'm going to try a couple different things here. But yeah, I think that's important, right? Different headaches can be caused by different things. You know what I mean? So some headaches are caused by nutritional deficiencies, some are caused by spinal misalignment, and yours is a complex case. You have a little bit of everything, but underneath it all, you have Arnold Chiari malformation, which, for those of you that don't know, is an issue where the basically, we were even talking about this a second ago, but where the brain actually kind of puts some pressure on the base of the skull, where it turns into the spinal cord. It gets a little crowded down there. So how would you describe it to someone who's never heard of it before?
It's just my brain is squeezing into that hole where your spine connects, and now that I'm aware of it, I can feel it more. Like if I get certain headaches, it feels like pressure build up and such.
Yep.
I also have some food allergies to like peanuts and things, that if I eat those, I'll get headaches. I don't
Kind of
have
adds to it.
Yeah, I don't have the anaphylaxis. I will get migraines. So I'm finding different migraines happen at different points. So.
Yeah. And, you know, before getting under upper cervical care, what were some of the symptoms related to the Chiari and the spinal issue up there at the top? What were some of the symptoms that you were experiencing?
I have a lot of pain just in my neck, and it was always migraines in my neck. And I would go to my regular PCP, and they gave me all those migraine pills, but they never help because they focus migraines at the front of the head, and in the brain of mine, my headaches are caused because of like a neck pain more than anything. Like it feels swollen and neck painish, and then it causes a headache.
The pressure goes
up.
from the bottom up. And would that affect your quality of life, your work?
I mean, there were times where I was not able to do anything. No noise, no sound, no movement. Like ice packs and.
Yeah, it's terrible, and I don't think, myself included, people who haven't been through that, it's hard to appreciate a full-on migraine like that. You know, it just, I mean, the world just shuts down. Almost you want it to shut down because you can't process.
Oh yeah, and even now I will go back and be like, wow, I was really feeling well last week, and this one's really bad. Like every once in a while I'll get a really bad one, but they're very few and far between now.
Yeah, that's what I was going to say, is when did you first start under your journey under upper cervical care? How have you been doing since then?
My first in South Carolina, he got me to about a month out, and I I was going every 4 weeks, and
Yeah.
I had maybe one headache, and it wasn't even a migraine. It was just a
Yeah.
headache more than anything.
Yeah.
And about once every 4 weeks. But then we moved, and so I thought, maybe I would stabilize and I'd be fine not going. But then they came back like full force.
Yeah.
And that's when Dr. Andy Gibson, my dad's upper cervical chiropractor, referenced me to Dr. Ed in Rochester, New York.
That's right. Yeah.
And so we lived in Syracuse, so he was
It works out.
no upper cervical chiropractors there. But
Yeah. There's I like to tell people that there's probably about 2 or 3 upper cervical specialists in every major metropolitan area usually. But the more rural you get, the less there are. There's actually a really great resource, ucreferral.com, and it's a nice site that lists upper cervical chiropractors that are certified in one of about a half dozen techniques. But that's great because you got under the care that you needed, and then you moved over to Western PA here, right? And so for those people that have never been to an upper cervical practice, how would you describe the experience? Because sometimes, and we were talking about this, one of the downsides of Chiari is you're downright told, like, do not, above all else, don't see a chiropractor, right? Because the fear is that if the brain is sagging or the spine is squeezing on the brain, then you could potentially cause more pressure than you would want. So that's a scary thing, but yet it's something that's really helped you out when it's done right. So how would you describe that, the first few appointments? Does it hurt? Was it, how have you been feeling? What's the journey like as from a non-patient to a patient under upper cervical?
Well, everybody that I've seen has been very good at explaining the process of what they're going to do. Everybody's done everything a little bit differently.
Sure.
My first upper cervical chiropractor, he did x-rays, so there was like a lot of contorting to get like the perfect view at the top of the head and everything. Sure. And he was really good at explaining like how nerves are coming out of the spine and how it affects all these other parts. And he just used the little like hand tool that just
little impulse, right? Yep.
Yeah, and it didn't hurt at all. Yeah, no.
Yeah. And how long did it take before you started seeing some of those changes?
Pretty instantly, honestly.
Pretty cool.
Yeah.
Which kind of leads me to the last question I always like to ask people is, what would you say to someone else who's in your shoes? You know what I mean? There's a lot of people out there that have been diagnosed with these scary kind of things, whether it's full-blown Chiari or whether it's just reoccurring, persistent migraine headaches, and most people have been down the medical route, they've had medications, they maybe have tried chiropractors or haven't, but some of these kind of conversations come off as like, well, maybe that works for that person, but I've already had my atlas adjusted and there's no way it'll make a difference, or I've heard again that it's going to paralyze me and I don't want to look into that. But like there's, unfortunately, but also rightfully, there's some anxiety around it sometimes. And so any words of encouragement or things that you can think of to chat with folks that might be in your same situation? I
am always trying to get people to go to upper cervical chiropractors, yes. Like anytime anybody mentions like, oh, I'm feeling like this, I'm like, go see one of these people.
We're actually going to be starting restarting or reviving an international upper cervical advocacy association soon enough. So I'll have to let you know that, because most of the time, most of our patients and patients in upper cervical are in the same boat. They've had their lives radically, dramatically improved, and they really do want to help other people. And the association is a way of like connecting with other people that have that mindset, giving them resources and like other things that may help out, you know what I mean? But then also equipping them to be able to better explain it, because it's tough. It is a hard thing to fully wrap your head around. But I really do appreciate you sharing. I really do. And I have to thank you guys for hanging out, especially with the light coming in and out and in and out. But I told Mallory before we got started, I said, hey, this is just real life, man. This is real life. This is not some big fancy production. This is just, I wanted you guys to hear Mallory's story because I think it's a very powerful story. I think it's important to realize that people do have options. You know what I mean? I think that's huge.
A lot of people get used to their pain and they almost like ignore it and just, oh, it's not that bad, but it's way bad, and you don't know how bad it is until you get help, and then you're like, oh, now I feel great, and then it comes back and you're like, wow, that's really bad.
I try not to harp on that because I don't want to ever be accused of being a fear monger or emotionally manipulating people. But the reality is it's a scare. And again, I've never been there personally. I have people in my life that have been there, but 100% yes. The downside, and actually ironically, that association I was talking about, one of the founders had trigeminal neuralgia, nasty pain syndrome. And he wrote a little booklet, and he tells his story about how, when you're in pain, chronic pain, it's like the world darkens. People can't relate to you. You think this is just the way that it is. It's the way that it's always going to be. And the reality is that no, it doesn't have to necessarily be. There's always hope, man.
Yeah.
The body's a miracle. There's always, you got to keep trying. You got to keep doing different things. And our motto on the back of our business card is healing starts at the top, because the brain is what controls everything. So in our mind, it's like, well, we can't promise that it'll be a cure-all, but we should at least look there. I mean, that's what regulates this stuff. That's where you're
I mean, compared to surgeries and medications and the insurance companies just constantly like, well, now you're not better, so do this, then like, I would rather go an easier route than. That's
a great point. So I'll let you go, Mallory, but I really do appreciate you hanging out with us today. Thank you guys again for hanging out. I'm sorry about the videos quality. If you have any questions at all, please do ask them. You can put little comments in there and questions, and I'm sure Mallory and I can pop on over and ask them. Again, a nice resource is ucreferral.com if you are outside of the greater Pittsburgh area looking for a specialist. If you're in Western PA in this region, I'd love to help you. Otherwise, any questions, concerns, referral needs, just let us know. Please share the video. You never know who might also need the information, So other than that, thanks, guys. We'll see you next week.
See.
Bye now.